Hello besties, welcome back to my channel. It's always a delight to be here. To all my returning subscribers, thank you so much for all your support. I'm grateful, and if this is your first time here, you're welcome. On this space, we basically talk about nothing, my life and experience as a practicing nurse in Nigeria, Christianity, and lifestyle in general. So if these are the kind of content that interests you, please consider subscribing. It's totally free. So guys, today I want us to talk about something very important that a lot of people are going through but it's not so talked about. And the topic for today would be personality disorders. Now, a personality disorder is when the way you feel, think or act causes you intense distress, deviates strongly from the societal expectations, or causes you difficulty functioning normally as a human being. It is more than just having a bad day once in a while. It is a behavioral pattern that occurs over a long period of time. Symptoms always start to show at your late teens or early 20s. This goes as far as causing serious issues for them, affecting their family life, social activities, work, school performances, and overall quality of life. There are so many personality disorders, but for the sake of this video, I will be mentioning 5 most common ones, and I would also explain them briefly so that we'll understand better and know as an individual which one is affecting you or someone that you might know. We all have personality disorders, but it just depends on how intense it becomes. The first one I want to talk about today is OCPD, and this simply means obsessive compulsive personality disorder. This disorder is marked by an extreme and consistent need for orderliness, perfectionism, and control, without giving any room for flexibility. An example of a behavior of someone who has an OCPD is, let's take for instance, the person drops a perfume on the table and a sibling or a friend comes into his or her room to pick up that perfume and spray and drops it on the bed or also on the table, but not at the exact spot where the person kept it. The person freaks out. They want you to do something perfectly and exactly the way they do it. So you must return that perfume at that exact spot where the person kept it. And this has to be continuous and consistent for you to know that this is no longer normal. The next one will be narcissistic personality disorder. This is a condition that involves a consistent pattern of perceived superiority and pomposity. This group of individuals lack empathy and they always want to be admired. They see themselves as better than any other person and they want to be the center of attraction. They always feel that they deserve a special treatment. And this trait has to be consistent before you can start saying that this person has a narcissistic personality disorder, or before you can start saying this person has a problem. The third one on our list today would be borderline personality disorder. This group of people have trouble with managing their emotions. It goes a very long way in the way they see themselves. It makes them feel an uncertain way about themselves. This results in low self-esteem and mood swing. And this personality disorder can cause a lot of trouble in relationships. The fourth one will be paranoid personality disorder. This group of people always feels that someone is after their life. They always have fear and distrust for people, always thinking that someone is after their lives, even without any reason or evidence of suspicion. They always feel threatened that someone is trying to harm them. So this also can cause issue in their relationships, either with their spouse or with people in general. And this trait has to be consistent. Always notice why I always say consistent. It's not like if it just happens once and you say, oh, this person has a personality disorder. No, it has to be a consistent for over a long period of time. The fifth one, which is going to be the last, is avoidant personality disorder. These persons feel shy and also feels that they are not as good as others. They always avoid people and are always on their own to avoid rejection from people. They are highly sensitive to being judged by others. Now, remember that the first one I mentioned was OCPD, which is obsessive compulsive personality disorder. Now, it is different from OCD, which is obsessive compulsive disorder. OCD is a mental illness, while OCPD is a personality disorder. OCD is characterized by anxiety and fear. So it is totally different. Okay? You know what most of us say is, oh, this person has OCD, this person has OCD. OCD is totally different from OCPD. People with OCPD usually have little, if any, awareness of their problem and situation. So guys, these personality disorders, they are usually diagnosed by qualified medical professionals, and one of the ways they are diagnosed is through medical examination, taking past medical history, and this condition must have been consistent. Consistency is one of the ways you can diagnose a personality disorder. Now, what are the treatments for this condition? Most personality disorders is a psychological problem. So it has to do with therapy. So we have cognitive behavioral therapy, we have psychodynamic psychotherapy, we have dialectical behavior therapy that involves talking one-on-one. Then we have some medications you can give to those people, like antidepressant, mood stabilizers. Then for people that have OCD, you can give them anti-anxiety drugs. And also you can engage them in group therapy where they have to meet other patients with similar problems. It is not a death sentence. It is something that can be worked through the help of your health provider. So if you're feeling that, oh, because you have a personality disorder, it's not curable, it's not treatable, what do? You can be treated, you can be taught to control yourself, you can be taught to live with it. So guys, to avoid this video from being too long, I think I would stop here today. I hope we are able to learn something, and I want us to be conscious of ourselves, our behaviors, and the behavior of people around us, so that we can be able to notice some of these things. Is that okay? Okay guys, if you have watched up to this moment and you have not subscribed, you are wrong. What are you waiting for? Please, now that I'm looking at you, hit that subscribe button. Okay guys, support your girl, like this video so that YouTube can recommend it to a larger audience. Okay? Alright guys, till I see you next time. Bye.